Hello, everybody. Welcome to Dental Voice Season 2 with Zyris. Thank you so much for joining us. My name is Rolando Mia. The purpose of Dental Voice is to meet professionals in our industry, in dentistry, and hear from them their perspectives, their opinions, and get some advice from them. Today, we have a very, very special guest, someone I am absolutely blown away, who is taking the time to speak with us and join us during the course of this. Everyone, please meet Stanley M. Bergman. Stan is the chairman and CEO of Henry Schein Incorporated. Now, he started at Henry Schein back in 1980, and then he took on the reins as the CEO of Henry Schein around 1989. In the span from then to now, working closely with the Henry Schein team, he and the team have built Henry Schein into a Fortune 500 company that's referred to as literally the absolute best place to work, any company globally, bar none. And we're here to hear from him, share some advice from him. And Stan, first of all, thank you so much for joining. It's an absolute pleasure. How are you, sir?
It's great to be here, Rolando, with you. I have been watching Sandy and you from a distance for many, many years, probably close to 2 decades. And you know what? You guys have done a great job for dentistry with the Isolite product, which at the end of the day is the way to make sure that you have sterility in the office.
Well, first of all, thank you. Yes, I want to start with this. First of all, congratulations. To that point, it's been many, many, many years. Now, I'd love to get your thoughts that Zyris and Henry Schein are partners. How do you see that Isolite fitting into the portfolio of Henry Schein's offerings?
Well, Rolando, here's the story. In 1985, it was alleged for the first time that a dentist contracted AIDS from a patient. Henry Schein kicked in at that time to develop the very first comprehensive infection control program in dentistry. Before that, if you went to a dentist didn't wear masks, didn't wear gloves, didn't sterilize between patients. And we went out to dentistry in San Francisco at the ADA meeting in 1986 with a slogan, sterilize as if your life depends on it. But the COVID-19 challenge from an infection control is very different. It's not about gloves, masks, and sterilizing only. It's about aerosol as well. And the Isolite product fits right into that range. So we believe that Isolite completes our offering for the sad coronavirus epidemic we're in, and for dentists to be back in business providing the comprehensive infection control, the sepsis control program. They need the Isolite product, and now we have the complete offering. Let me share with your viewers a little secret. We have represented the Isolite product outside the United States, a number of countries for a few years. And you know what? It works. We know that. So now we're delighted to be selling it here in the United States.
Well, first of all, thank you so much for that. On behalf of the Zyris family, Sandy and the team, we are thrilled and we're really excited. As a matter of fact, I want to show you. I wish Sandy were here, but look at that. Wow. Holy cow.
That picture was taken when I had a lot more black hair.
I know. Oh, you're looking good. But thank you so much for that. So, with regard to Henry Schein, this whole idea and infection control COVID, it's a big issue right now. And one of the things that hit the industry, dentistry today, and when we talk about the topics, is this issue of infection control and this whole issue of ready access to PPE. So I'd like to kind of ask you, I have to share, Henry Schein was and continues to be a leader and under your guidance, it's been doing that. One of the comments that I read here is that, according to a session with Fortune Leadership Next, you were referred to as the pandemic supply expert because of this context that you've built around ensuring that clinicians have ready access. Now, it's interesting. There's this juxtaposition that we're hearing about availability, cost, and then quality. What are your thoughts on that as it relates to dentistry and medical overall?
Well, Rolando, I hope we have learned a lesson from COVID-19. We have been saying for many, many years that there is a flaw in the supply chain of masks and gloves. So in 2015, we launched a program at the World Economic Forum in Davos. We launched the Pandemic Supply Chain Network, which was focused on ensuring that PPE was available. Several companies were involved in that. It was Henry Schein, BD, Becton Dickinson, UPS, and J&J. And we went to the leadership of the World Health Organization, the World Bank, the World Food Program. By the way, the World Food Program handles logistics in general for the United Nations. And we said, the time to figure out where supply chain starts and how it works is not when there's an epidemic, God forbid, a pandemic. We never thought of a pandemic. And we said the time to start thinking about it is not when we have a pandemic. That's not the time to exchange business cards. We got to do it before. And unfortunately, the world was too focused on vaccines, very important. But the world, until recently, thought everything could be dealt with through vaccines. It can't. You need infection control. We know this from Ebola. What happened in Ebola is the United States and the UK sent over tremendous amounts of infection control products to West Africa. It came there a little bit late, but it stopped the infection. We need to ensure that the worldwide supply chain for infection control products is working. That's the big lesson from Ebola, from coronavirus. Now, we had a perfect storm this time around, unfortunately, sadly. What happened is a huge part of the world's masks come from China and particularly Wuhan. The challenge was that Corona hit at exactly the same time as the Chinese New Year. So the time we needed to up production was exactly the same time as people had left to go home and the factories were closed. So we kicked in a number of countries to figure out how to deal with this. And the United States government in late March, early April, set up a FEMA task force together with 5 other healthcare distributors that are primarily in the providing of products to acute care, to hospitals. We joined and we dealt with this issue through FEMA. We didn't deal perfectly with it because there was a worldwide shortage. FEMA is a group of remarkable, dedicated government professionals, including a number of military officers that deal with logistics. And we were able to send planes into China and into Malaysia for gloves to bring the product out. We got through it, but we had a real big challenging situation. And I hope we've learned the lessons that we need PPE in stock and we need it available so we don't run out. Right now, the supply chain is reasonably effective. There's enough masks available and cleaning solutions. Gloves, there's enough, not in abundant supply because it takes time to build that up. So I think it is critical to ensure that infection control is understood in the doctor's and dentist's office and that supply chain is backed up with that. Henry Schein is committed to that, and we lead the Pandemic Supply Chain Network as the industry lead.
That is so cool, and I appreciate the context around that. One of the big questions that we keep getting is kind of this issue of cost, because when people all of a sudden needed PPE, the cost literally went through the roof, and then now, as it seems to be settling, there are still some of these. I mean, there's some stuff that's available that's incredibly inexpensive, and you hear, why are they charging us that when I
Yeah.
can get the same thing for so much less? What are your thoughts on that? And
Well, there's a bit of a challenge here. First of all, during this period of March, April, and May, governments went into the suppliers and bid up the price. Unfortunately, in the US, we had the federal government and the states bidding for the same products. So the price was pushed up, number one. Number two is there was also a worldwide shortage for a period of time on the raw materials that go into masks and some gowns. So we had a situation where the price went up because of supply and demand, and there was a big demand, and also because of raw materials. But there's a third factor, and the third factor is very unfortunate. A number of players not in the healthcare arena went in and bought whatever supplies they could,
right,
and hoarded the stuff. Also, companies that were interested in helping their employees were buying these masks, should not have bought N95s, not necessary. So we had this situation. I believe it's largely resolved for the moment. Having said that, one has to be very careful, because not all PPE in the United States is FDA approved. For a period of time, a whole bunch of stuff came into the United States. And I know from talking to our customers and actually talking to a number of deans of dental schools, they bought the stuff and it was not FDA approved and the quality wasn't right. So it's been largely dealt with, but there's still quite a bit of product in the supply chain that is not FDA approved with a quality issue.
wow, really good to know, because there are, when people have access to something that's incredibly inexpensive, I guess from a context that you set, you get what you pay for, and the idea
Yes.
of not FDA approved, you're actually potentially risking
Of
your
course,
or your team's
it would be
lives.
selling, there are many companies, many others that could come out with an isolite. But if it's not quality controlled and it's not FDA approved, it would be dangerous.
Very, very good. Very
So
good. We
what we
appreciate
did,
that.
Rolando, is we went to FEMA and said, what is critical is there are about 60 dental schools in the United States, another few hundred programs, hygienist programs, and other kinds of dental programs that provide services to the underserved. And we went to the FEMA and we said, a lot of these organizations, they bought PPE masks. They were no good. So we asked, could FEMA give us some product as a donation for dental schools, for hygiene schools, and for a number of other programs? And last week, we shipped several million of these masks to dental schools, hygiene schools, and other programs that are providing dental services to the underprivileged. And these products were given free by FEMA. There was a small charge for freight, but generally these have been delivered now, and hopefully schools will have enough product so that they can take care of their students and faculty that are providing free dental care in clinics.
That is so cool. Oh, so fantastic. Let me ask you this regarding that, and regarding the fact that now dental practices are coming back in and starting to work again. There's a lot of anxiety and stress that clinicians, that business owners, practice owners are facing because of this. They're kind of struggling with teams. At Henry Schein, you've done so many things to kind of overcome. What are some of the things, or what's some of the advice that you could give folks with regard to kind of how to overcome this crisis with teams, and what to consider as people are coming back and trying to keep everything together?
So, if there's one lesson from COVID, above all, is that the business of business is no longer just business.
The business of business is no longer just business.
People are turning to businesses and saying, we expect a lot more from you. We expect you to ensure that you're doing the best to take care of the needs of society. And I believe the same is being expected of professionals like dentists. People want to know that they can go to a dentist who's going to take care of the infection control. And you know what? The staff in the practice are saying, I expect my dentist to take care of me. So where we have advanced as a result of COVID is an environment where there's much more caring than simply dentist drilling or a company like Henry Schein shipping. People want to know now that the people we are dealing with in the professions or in business care about me. That's a big takeaway from COVID. There is a world where people are caring, and what is really, 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 really important is the notion of civility. People want to know that I'm being treated right. And I think dentists that take on this philosophy of helping the community, worrying about their staff, having more of a servant relationship with their staff than I'm a big boss, caring about the patient, about the comfort of the patient, about the infection control, having a broader view than drill and fill, will be very, very successful. I'm not worried about dental practices coming back. They're already at almost 80%. Of course, it's costing more. The price of PPE will settle. Less patients can be seen per hour because of the change in PPE. These efficiencies will come about. But I think dentistry is a profession that has huge opportunity, if only for one reason. And that reason is that there are a number of studies that have come out in the last 4, 5, 6, 7 years showing a direct correlation between good oral care and good health care. Take care of your mouth and your diabetes will be less acute. Cardiac, pulmonary. There's a study even that came out last year on Alzheimer's, and taking care of pregnant mothers will result in much better obstetrics. So I am very optimistic with the need for dentistry and the public understanding that need. Having said that, dentists are squished now a little bit in the middle because they have to get their efficiency up. Not so easy with the infection control. And we have to figure out how we're going to deal with the price of PPE. And we're, of course, working on that.
Thank you for that. Your reference to the link of the oral to the systemic is a huge thing, because it's this COVID. And because when you look, Henry Schein is in place both in the dental and the medical. You've got the ability to kind of marry the two. And it's driving the requirement that, hey, oral health is a direct link to systemic health. So your reference to that is amazing. It's kind of, there's a quote that you use, doing well by doing good. I think that's a Benjamin Franklin quote. And it sounds, you apply that across everything that you're doing. The number of awards that Henry Schein has received is mind-boggling. I mean, and that is definitely a testament to what you've been doing, what the Henry Schein team has been doing, and that kind of the sentiment that you're sharing is pretty cool. I was looking at at Henry Schein prior to getting on, and just very recently, Fortune 500 company. With Fortune, you were named, or Henry Schein was named, company that exerts a positive social impact for the initiative to stem pandemics, as well as change the world. How are you doing that? I mean, how do you maintain the energy behind that, and what are you doing to continue that?
Well, I think there are many companies that, of course, do this, Rolando. What motivates us, and I think it's the same with Zyris, is that we want to do well for our customers, for their patients, for the communities we're in, for our team. And I think if you focus on that, it is self-energizing. And there's good news for us in the dental industry. We're in healthcare. And what better place to practice doing well by doing good than dentistry? We're actually helping people from pain with pain. You're a first-line responder in the COVID period. And at the same time, you are mitigating issues from a healthcare point of view through prevention and wellness. Look, at the end of the day, Rolando, the only way we're going to solve the healthcare crisis we're experiencing in the world, because there's a greater demand for healthcare than there's resources, is through prevention and wellness.
Yeah.
Dentistry is one of the greatest wellness and prevention programs you can have.
And I would agree. It's so gratifying to feel. Prior to this pandemic, dentistry was identified as kind of the center for infection. And now there was a recent study by the ADA indicating that virtually no cases, because of the focus on infection control, because of the understanding of PPE and all that.
Yes.
So I fully agree.
What we need to do, Rolando, we need to get the word out. The ADA, actually in ADA News today, published an article showing that dentistry amongst all professions were tested amongst the lowest.
Right.
From a virus point of view. Dentist offices are safe. Dentists have been practicing infection control since the mid-'80s. I don't want to say anything wrong, bad about medical doctors, but dentistry was there before on infection control. Aspects of the medical world were there, but dentists wore gloves, masks, cleaned between patients from the mid-'80s. And the results have been good. Infection is minimum in hardly any in dental offices.
Oh, wow. That is so awesome. Let me ask you this. COVID is here to stay. And COVID is, as we're learning more, things are becoming somewhat clearer. Oops. If you were to summarize the top 3 things, people listening to the session, what would top 3 things people listening to this to consider to make what we're doing, the world, our professions, a better place for COVID? What would those be? I think you already said one, but if you could sum that up, what would those be?
Well, of course, what is important is to understand the science and keep up with it. It is changing rapidly. I think the profession is actually keeping current, but we need to keep current. If you're asking me, at this moment in COVID, I think every healthcare professional needs to get the word out on infection control. And that involves basic hygiene, cleaning, washing your hands. And yes, I don't want to get into politics or not, but you got to wear masks. We do know that. And we do know that the public needs to wear masks. And who is better to tell the public than the trusted dentists? So I think dentists need to get out in their communities and talk about the importance of wearing masks, cleaning your hands, and yes, testing. We will have, hopefully, in the not too distant future, much more rapid tests, point of care. And dentists in most states in the United States will be permitted to administer tests. These inexpensive tests will be available at the point of care. I think dentists have a major role to play in educating, testing, and making sure that dentists communicate to the public some of the misconceptions, dealing with some of the misconceptions that are prevalent today, whether it's in the media, social media, or in communities in general.
That is cool. Thank you for that. If you were to, I think someone's trying to get to you.
Yeah, it's
I will. If you were to sit down and share, what is the biggest thing that this pandemic has taught you about change, what would that be?
well, I would say, first of all, serendipity. There are so many different things that have occurred as a result of this pandemic that came along that we never planned for. Of course, the fact that you're interviewing me virtually today.
Yes.
Virtual telemedicine, teledentistry, aerials, systems. These have all come about as a result of COVID. I just want to put a big asterisk. I will say to you that working at home is important now, but it's not going to be good permanently, because humans are social animals and we want to interrelate with people. So I would say to you, what is really, really important is that we take advantage of all the changes, including, I just heard it on a program I was on earlier on, that from a digital point of view, we've made 5 years of progress, literally in a few months.
Right.
All of these things are exciting, and I think dentistry will advance significantly from a digital point of view. But that's all true and great. The big caution is we have to make sure that the touch, the human touch, the human communication is there, because that's what people are all about. And you know, we had a fellow that ran the Dental Manufacturers of America. This was before DTA. His name was Dr. Edward B. Schultz. Dr. Schultz founded the Entrepreneurial Center at Wharton. And this was already in the 90s. He got up at a DMA meeting and said, I caution you to be careful of voicemail, because you leave messages and it's not the personal touch, because you don't allow somebody to talk back. I think we have to get back to an environment where people are communicating in rooms. We will get there, I'm sure of it. But we also need to be aware that it's not good enough to deal with COVID. We need to deal with pandemics in general, which are here to stay as more people co-inhabit this planet, where we have, and when we get into politics, environmental issues as well. So the bottom line is we're likely to have more of these kinds of challenges going forward. And human beings are brilliant. We will deal with the issues, but we need to be aware of them.
Oh, I love that. I love the message. I love the sentiment. And I so agree with you. You're right. We've seen each other dozens of times, and seeing each other virtually, though it's great, there isn't the same connection, I would say.
It's not the same.
I can't, wait. You know what? I can. Check this out. I can still, because we're being virtual, I can still, hold on, just smile. I'm going to do a selfie with you while we're on this phone.
You know what? We're going to do a selfie with the two of us, and then you're going to Photoshop Sandy in, so the three of us are together.
Well, hold on. Check this out. Look at this little message. Stanley's faith in our products.
And our products and unfailing support over many years have been a pillar that inspired us to become the company we are today. We are thrilled to be partners together to improve dentistry. Perfect. Stanley, I 100% agree with you. We, of course, will work together to advance infection control and the quality of dentistry. Your product matched with our other PPE products and our sales organization that is so close with our customers, because our sales force help customers really operate a more efficient practice while they're providing better clinical care and provide those services. Together, we'll do a great job.
So, in closing, if we would, and first of all, I'm so thrilled that you're willing. I love kind of the perspective you have. I love the message. I'm sure you could share so many things with us regarding how you're building Henry Schein and how you're making sure that the team is connected. But if you were to sum up for our viewers, for the people who are going to watch this session, a message to inspire and reassure not just us, but our community that we will get through this, that we will be able to be stronger than ever, what would that closing message be to our viewers?
Well, I'm absolutely sure we're going to get through COVID. There's no question about it. We have, especially in the United States, we have amazing science. Our universities, our medical and scientific institutions are remarkable. We need to let our scientists do what they do. We will get through this. I'm absolutely sure we will have a vaccine. I cannot say it'll come, in November or December. We will have one. We will get the supply chain worked out. Can't say it's perfect. We'll get it worked out. But the only caution I have is once this is worked out, a year or two goes by, we cannot forget PPE, supply chain, infection control, taking care of the environment so that we live in a world that is sustainable.
That is awesome. Oh my God.
Total confidence in dentists, hygienists, the dental labs. It's a great community that cares and is quite frankly bringing new technology to life every single day. We're fortunate. We're servicing a great profession.
Oh, I love it. Thank you so much for that. Thank you so much for taking the time. It's amazing. Look at this. We've got people here, Zyris and Henry Schein, Dr. Mark Hyman. And then, as you've mentioned, you've even got some old friends coming here, Steve, about win for the industry. The things you share with us and the perspective that you have and the support that Henry Schein is absolutely amazing. And on behalf of Zyris and the team, we're thrilled that we're partners now and really appreciate you taking the time. Months from now, and we're talking, 3, 4, whatever, as we're through this, would you be willing to join again and kind of give an update on how things are going? And would you be willing to share that?
Always ready, Rolando. Look, you guys are very thoughtful people. You've thought about infection control very well. You have a great product, great team that makes it happen. And our team are thrilled to work with you. And in that context, I'm available. Any of our management are available. They will all say the same things at me because essentially we have it in our DNA to help practitioners do well by doing good and advancing society's needs through oral care.
Well, thank you for that. And you know what? Please, Henry Schein has only been professional, gracious, kind, and it's really cool. You've always been, as busy as you are, you've always taken time to take a couple of minutes, even to give me grief, which is something that I appreciate. And
I don't give you grief anymore. I gave you grief because we couldn't represent you for 20 years in the United States. In other countries,
wait, hold on. Look, just look at me. I'm going to take a selfie with us. I'm going to send this to you. Hey, first of all, Stan, thank you so much for joining us. Really appreciate you taking the time. Folks, those of you who are watching this, if you like this content, please share it. If you have any questions about Zyris and Henry Schein working together, please let us know. You can go to Zyris, www.zyris.com, or call us directly. If you have questions about Henry Schein, or if there are questions about understanding, either contact your local Henry Schein representative or go to the henryschein.com website. Stan, you are absolutely wonderful. I really appreciate you taking the time to speak with us today and kind of share your insights. It's inspiring to see. Love the passion that you have, and the things that you're doing are incredible.
Thank you, Rolando. Don't change. Be the person I met a couple decades ago. Sandy. Thank you.
Thank you so much. Have a great week. Please be safe, and I'm sure we'll talk again.
Thank you.